Hello and welcome, everyone. Thank you for joining us. I'm Congressman Brad Schneider, and it's my privilege this evening to host this conversation with some leaders in our community, working with Latino organizations to talk about the disparities that we're seeing in our community on the effects of the coronavirus and COVID-19. Before I begin, I do want to do some housekeeping things. This evening is being simultaneously broadcast in Spanish. If you want to listen in Spanish, you can, there should be a button to press on the screen to choose either English or Spanish. I will tell you though, we've been having some technical difficulties with the two lines. If we do run into trouble,
en caso de que tengamos alguna dificultad,
and I think we do have I can hear the Spanish, so I think it's working, but if we do run into troubles over the course of the evening, we are recording this and we will post this on our website and on YouTube, and the Spanish will be there as well. So we're doing our best to make sure that everyone can participate and be comfortable. But and again, I want to thank everyone for joining us this evening. I'm grateful you are with us. I'm grateful to have a wonderful group of panelists joining us this evening. Luvia Quiñones is the Health Policy Director at the Illinois Coalition of Immigrant and Refugee Rights. Dulce Ortiz is the Executive Director of Mano Family Resource Center. And Angie Santillan is the Clinical Practice Manager at Rosalind Franklin University Health Clinics. So thank you again for being with us this evening. What I want to do before I turn it over to the panelists is just take a few moments to go over a couple of things we're seeing within our community. As you all know, the COVID virus or the COVID-19 pandemic has affected all of our communities across the nation, literally across the world. But it is clear that it is affecting the Latino community particularly hard. Just a couple of statistics within Illinois, Latinos have the highest proportion of cases of any ethnic group within the state. In Lake County, when accounting for differences in age between populations, for every one non-white Hispanic person being infected and getting sick with COVID-19, 8 Hispanic residents are contracting the disease, an 8-to-1 ratio, which is extremely dramatic. State data shows that 54% of Latinos tested are confirmed to have the virus, which is the highest percentage of any group within Illinois. Just some proportions in general, for whites, it's 14.4%, 31% for African Americans, 30% among Asians, and again, 54% positive rates among Latinos. Part of that may reflect the fact that the Latino community is being under-tested with respect to other communities, but also it's a reflection, I think, of the high positivity, the high impact this virus is having. It's not just in Illinois, it's across the country. For example, in New York, Latinos and African Americans are dying at twice the rate as non-Latino whites in New York City, and we're seeing that in other places around the country. Our goal today is to explore with our panel the reasons for these disparities. We also want to acknowledge that the pandemic is exposing and making worse inequalities that already exist. What we're seeing in these disparities, and it's not just because of the moment, because of things that have existed in many cases for a very, very long time, and things that we need to understand and work to address going forward. In Congress, just to share some of the things that I'm working on, we've already passed legislation and signed into law to make sure that testing is free for everybody, irrespective of their immigration status, irrespective of their economic status, insurance status. We want to make sure that everyone in the United States, wherever they are, whenever they need it, can get a test. We need to do a much better job of making tests available, but the cost should be free for everyone. We wanted to make sure that not just that it was testing, but if you are positive, if you are infected by the coronavirus and you come down with COVID-19, we'd like to see the House is working to make sure that treatment is well available to everybody. We need to make sure that passes in the Senate, working to do that. And that's part of the negotiations going on. The other piece, and we'll talk about this, is part of the reason we're seeing the disparities is because it's the essential workers, people working in essential industries, whether it's healthcare, making sure that our food supplies are safe and secure, that stores, grocery store shelves are stocked, people transiting material and medical products, food across our country. Many of those essential workers are coming from our Latino community. And many of these people putting their lives on the line literally just to go to work. And it's something that we need to address. Compounding that problem is the fact that we have had shortages of the protective equipment, PPE, personal protective equipment, the gloves and masks, the shields, the gowns people need to be safe as they're working, and we're trying to get more of that and investing in that. So we need to do a better job of keeping people safe, preventing people from getting sick, identifying those who do get sick, and when they do get sick, making sure they have the treatment they need. And we need data to understand that. So we are also working on legislation, for example, the Equitable Data Collection and Disclosure on COVID-19 Act, nice short name, but this is legislation that would give us that information, and I continue to work on that. So just, that was my general introduction. What I really want to do is have a broad conversation with our guests. I'm glad today to be joined by these three panelists who on a daily basis are out in our communities, making a difference, lifting us up. Again, thank you for each and everything that you do. Luvia Quiñones, Health Policy Director at ICER. I'm going to start with you, and if you could take a few minutes and talk about what you're seeing, what your organization is doing, and what we should be aware of.
Great. Thank you, Congressman. Good evening. Buenas tardes. Thank you again for the invitation. I think you mentioned a few things, Congressman, that unfortunately are impacting our Latino and overall our immigrant community. I would say that not only is it unfortunately because many individuals in our community are essential workers, but I would also add that there is a lot of fear and anxiety over the years, especially this last year since the public charge rule was enacted in February. And I will say lastly, even before this crisis, the number of uninsured Latinos is significant. So not only did they not have access prior to this crisis, but they also were the high number of individuals overall around health disparities, whether it be chronic illnesses or overall just the lack of having a medical home. I think what we're seeing in this last 2 months and a half, I believe that we've been going through this crisis, is individuals either losing their jobs because of the shelter in place, but also seeing a decrease in their hours. And unfortunately, as you referenced, many of them are not eligible for any of the federal funds. So really seeing a lot of organizations like Mano and others really stepping up and trying to provide needed services, but obviously it's still not enough.
Great, thank you. And next we'll hear from Dulce Ortiz, the Executive Director at Mano.
Buenas tardes a todos. Thank you so much, Congressman Schneider, for the invitation. As you know, Mano, our mission is to empower immigrant families to become full participants in their communities. And I think that more than ever now, it's really important for us to be able to support our Latino community, as you know, Luvia. And as you mentioned, our community has been one of the hardest hit, and unfortunately, the one that lacks the resources and the one that lacks sort of like a plan B of where to fall back. When we started noticing, that our community members were losing their jobs, as we know, some of these members worked at in the service industry, which was one of the first ones to shut down, restaurants, so on and so forth. They were highly impacted, especially in the areas of Highwood and Highland Park. For the Waukegan area, most of these community members work at factories. And we started noticing a pattern where a lot of these community members were getting infected at their place of employment and not really, unfortunately, being heard by these employers. So one of the things that Mano has done in working for their behalf in the advocacy efforts is work with the Lake County Health Department to be sure that our community members feel safe and protected, that they are provided with the necessary protective equipment, that they are also, their places of employment are, sanitizing, making sure that the facilities are safe for them to work in. But that's one of the trends that we're seeing, that unfortunately many of these families have been infected at their place of employment, bringing the virus into their homes. One of the things that, most importantly, one of the things that we came up with was our TANDA, our Emergency Assistance Fund, which helps undocumented individuals with basic necessities, access to food, prescription medication, but also because of the impending DACA decision by the Supreme Court, we know that some of the DACA recipients have lost their employment. And fortunately, they don't have the $495 available to renew their fee. And if they do, most likely it's going to be to help out their family members. So we're also assisting with DACA renewals. We wanted to make sure that those that are eligible for public benefits are able to access benefits. Unfortunately, because of the environment that this administration has created, many of our community members are afraid due to the public charge. And so that's also something that we're seeing. Many families that could really benefit from this assistance are turning away that assistance because they're afraid that maybe later in the future it might affect their opportunities to become, legal citizens here in the United States. And so there are a lot of barriers. There are a lot of things that we are doing to work with our community members, with our partner organizations, but we're also very grateful. I want to give a shout out to the Mano staff that have been working from home almost nonstop to be able to provide these services, but also to our donors and our funders. Because of them, we've been able to assist more than 500 families, and we've been able to raise approximately $300,000 for this fund. So we're very grateful for that, but we still need more donations.
Yeah, I imagine, but that's really incredible. And the generosity of our community across the board has been really remarkable. It's unfortunate that too many organizations and too many people are left relying on this, and we need to make sure that the government support is getting out where it needs. But last but not least, let me turn over to Angie Santillan, Clinical Practice Manager at Rosalind Franklin.
Yes. Hi. Well, first of all, I want to thank you, Congressman Schneider, for this opportunity to be able to bring and address the concerns of our community, of our Latino communities who are struggling with the testing or getting access or getting to the healthcare facilities, people who don't have transportation. So to bring this information and to hopefully bring the resources to them versus them coming to us, being a healthcare facility and now a COVID site testing, we are trying to look at ways to bring that service to the communities around Lake County, Round Lake Beach, Antioch, Zion, the south side of Waukegan, Mundelein, and trying to partner up with other organizations to obviously, one of the things that we struggle the most is the funding for the testing, especially for the Latino community that do not have insurance access to state funds or government funds. And John Nyland, who's our president, has been working tirelessly to try and find partners or ways to find funds to be able to provide these services to our communities. We have a drive-through testing site here. We have certain days for that. We are talking about expanding it to actually bring it to them through our community care coach, which is a mobile coach who drives out to the communities, either churches or schools or nursing homes, to try and test as many people as we can, regardless of your immigration status, regardless of your income status, regardless of insurance status. But we have the staff, we have the ability to do that. We just really need to find the funding for the testing. So that's our biggest goal right now, bringing the testing to the community.
Well, thank you. And as I said in the beginning, the law that Congress passed, the president signed, says testing is free to everyone, regardless of immigration, regardless of employment, regardless of insurance. So absolutely focused on that. Well, thank you, and thank you for the introductions. Let me ask a couple of questions. I do want to apologize. I was just notified that our translation service is not working. This is a new service for Zoom, and I guess the wrinkles haven't been fully ironed out. As I mentioned, we are recording this, and we will make sure that the translation is put up with the recording, so everyone will be able to access, but I do apologize. We touched on a number of the reasons in our introductions on why the Latino and other communities of color are being impacted the most in this crisis. But I'd like to spend a little more time digging down. And what are you seeing as some of the key, whether it is things that existed in the community prior to the pandemic, elements, we touched on people going to work, having to go to work during the pandemic. What do you see as the key things? And I'll go across as it shows on my screen. Dulce, why don't I start with you?
Yeah, as I mentioned earlier, one of the things when our community members were calling in for the Tanda Assistance Emergency Fund, they were mentioning, how they were getting infected at their place of employment, and they didn't feel the adequate personal protection equipment was being, made available to them. Also withholding information of coworkers that had tested positive and that they found out, through word of mouth and not necessarily from the employer. And I think that, that's one of the biggest issues that we're seeing here, just through, let the public know how the inequity is that we're seeing right now, especially in Lake County. When we look at the Lake County statistics, right now, as of today, we had 6,831 people that have tested positive for COVID-19 and 216 deaths. Out of those 6,831, Waukegan has the most, it's the community that has the most individuals that have been infected with 1,964. Compared to Lake Forest that has 95, compared to our neighbors, Gurnee 189, compared to Libertyville, which is 69. So right there, then you can see the inequity, because these individuals don't have the luxury like us to work from home. They have to they have to work, and also just the fear of losing their jobs and the fear of the plant closing down, and maybe their family members also losing those jobs. I think that not having that basic support and resources from the state or federal government are pushing our families that are already in survival mode to make decisions that no family should be put through. So those are the major issues that we're seeing, in addition to what Luvia stated, most of our community members don't have health insurance, don't have access to adequate health care, and then also encountering barriers, just like the testing facility here in Waukegan. And thank you, Congressman, to you and your office for working with us when it was first brought out to our attention that they were asking, individuals that wanted to get tested if they were citizens. And so that's something that's very intimidating. That's something that, we don't know how the information is going to look. It travels to word of mouth. And so that is a deterrent for our community members to say if they were exposed to a family member, say if someone at work tested positive, they're not going to want to put themselves or their families at risk.
Right, and just to emphasize that is, number one, they shouldn't be asking the question, but more importantly, no one has to answer that question. That testing site will accept you under any circumstance. It's open to all comers, and if they shouldn't ask the question. If you are asked the question, just leave it blank. You do not have to answer it, and you can still be tested. So that's important to know. I also, you talked about Waukegan with almost 2,000 cases. Round Lake Beach has about 350 cases. Round Lake, 120 cases. Mundelein, 250 cases. So it's not just isolated to Waukegan. You're seeing it where we have a large concentration of people who are working in essential industries. Part of it is the federal government has to do a better job of getting to the states the PPE, so that people who are being asked to work have the protection they have. But it's also, we need to make sure the employers are providing the PPE, assuring the social distancing, and that people can be safe in their work. Luvia, I'll go to you next, and you're taking, your organization works with immigrants as well, specifically with immigrants, not just within the Latino community, but your thoughts on some of the things that are driving the differences.
I think similar to what is happening in Waukegan, we have noticed throughout the state of Illinois that certain cities, neighborhoods that have large concentrations of immigrants, as well as low-income individuals, are facing higher number of COVID, whether it be deaths or testing, similar to, unfortunately, in the African-American community, that also continue to see an increase. And I think a lot of the inequities are largely due to that. I think in our community, not only some of the things that have already been mentioned, but also the lack of language accessibility, as well as cultural competency. We all know, as a child of immigrants myself, that when it comes to certain things, either if the parent doesn't speak the language, they rely on the child. And vice versa. And also in the immigrant community, we have a large number of mixed status families. So a lot of the times, even if the person may be a US citizen, but if they have a relative that's undocumented, then they're not going to want to access certain things. And that leads, unfortunately, to further not only the inequities, but also not always wanting to seek care or attention that they may need. So I think, unfortunately, some of the things that we're seeing in the Latino community are not only there. I think because other immigrant communities, whether it be in the Arab community as well as Asian, the numbers are a little bit lower in size, but also the way that their ethnicity, race gets tracked, unfortunately is under white in a lot of the cases, especially for the Arab community. So, but we know that it is happening, and unfortunately the numbers are high, and again, for similar reasons.
Great, thank you. And Angie, from the your perspective, and sitting at Rosalind Franklin, what are you seeing?
Well, sitting at Rosalind Franklin and having conversations with our patients, it's the lack of pay sick leave, and these individuals continue to work even when they are sick, or wanting to go back even though they're still testing positive, still having symptoms. Why? Because of paying bills, lack of insurance, making sure that their family has food security. These individuals can go out, and they have to go out more often than others to the grocery store, therefore exposing themselves and then exposing their families. So I think one of the biggest things that I've had conversations with our patients has been, again, the lack of the benefits at their employment, that these individuals continue to work and expose other workers, but then also exposing their families, their kids, the elderly who have these underlying conditions. So we've had a lot of conversations, a lot of different conversations in the grocery stores. I have my scrubs on. People stop me and they ask me these questions, like, where can I go? Again, I've mentioned it before, is the lack of not having a vehicle. There's a family in a household of 4 or 5 that share the same vehicle, and they work long hours. So having accessibility and transportation to come to our site, it's difficult for them. And along with what Dulce was mentioning, as well as Luvia, I mean, this has been going on not just in the pandemic. I mean, obviously it's worse now, but it's been going on for a really long time.
Right, absolutely, and we'll come back and talk about the transportation and health insurance. Luvia, I want to first go to the testing, and we've touched on some of the pieces, the barriers to testing, the immigration question, obviously, is an example. But are there other barriers to testing that we need to be aware of? Again, Congress made it very clear: testing should be free to everybody. Period. Stop. But we know that, especially within the Latino community, there still appears to be a lower take up in the testing, and we want to get everyone tested who needs to be tested.
Yes, I would say that the other two things that we've been hearing is we know that at some of the sites they do ask for IDs. And I would like to clarify here that the main reason that they're asking for that is mainly just to make sure that the person lives in Illinois. I know technically it's resident of Illinois. I don't always use it that way because in our community, when you say resident of Illinois, a lot of the times they think they have to be a legal permanent resident. So I want to make sure everyone knows that yes, you may be asked for an ID, but that could be anything that has your picture, whether it be your passport, even if it's a foreign passport. For those of you that are from Mexico, as well as a few other countries, if you have a matricula, anything that just proves your identity, or even if you have a utility bill. We are working with the state as well as the Illinois Department of Public Health to make sure that no testing site turns anyone away for not having a state issue ID. So I would just like to assure people, one, that that's the reason why they're asking for that. I will at the end provide some resources of where people could call in case they are having issues around that. And I would say the second thing that's holding back individuals is also not knowing that even if they're uninsured, that they could access the testing for free. I think for the longest, because of the capacity, individuals didn't know that if you have the symptoms or in the last few weeks, if you are an essential worker, that you could also access any of these testings. And I think lastly, connected to some of the earlier comments, sometimes people think that whenever they're receiving something for free from the government, it could be connected to public charge. So I also want to assure people that by getting tested, yes, the test is free. It does not affect you anything regarding public charge, even if you're undocumented.
Thank you for bringing that. That again, that's something we put in the law that provided for the testing. We need to, I'll say it over and over, we have to have everybody tested. It doesn't matter, you know, I want my next door, I want everyone in my neighborhood to be healthy, in my community to be healthy. And if someone gets sick, we want to know that they're sick, get them the treatment they need, and try to isolate them from getting their family sick or anybody else sick. So the testing becomes really important, and we need to push that out. Dulce, at Mano a Mano, you're working with a lot of people in the community. Are there stories you're hearing that might demonstrate why people are reluctant to be tested or getting the treatment for the virus? Dulce, you're on mute. You might be there.
One of the things that we certainly are hearing is in the beginning, unfortunately, testing was not as available. And so they were having a very difficult time trying to get tested. For those that did get tested, unfortunately, now they have big medical bills that they have to pay. And so with the education, community education, I think that we have to do better in letting our community members know in their language, as Luvia said, language accessibility, that testing is free. But again, when we talk about the barriers about the citizenship question, that poses a risk to our families. One of the stories that really stands out for me is with our TANDA applications, our Emergency Community Fund. I go through those applications, and I did see one of, a mom, I believe it was a family of 5. She had been hospitalized for 7 days, and she got a hospital bill for $21,000. So when she called the hospital, she was told that it was her responsibility and that she would have to figure out a way to pay. And so when you hear these stories, and we know Latinos talk, we like to talk, we like to talk to our friends, our family. When you hear stories like that, and you're sick, you're gonna do, whatever you can in your own home, thinking that, you're gonna save yourself some money, but at the end, we know that, you're just gonna, things are gonna progress and you may get worse and you'll need to be hospitalized. But just the fear of not having health insurance, the fear of not knowing how to pay for it, the fear of not having a job, that you're trying to even provide, just food on the table and making sure that you eventually have enough money to pay your 2-3 months rent that you're behind in. I think all of that, it just, it creates like a domino effect that individuals, are just afraid of not only the expenses, but also afraid to find out that they do have it, and what does that mean for them? I do have actually a family member that didn't want to go get tested. He was very sick, didn't want to go get tested just for the fear of finding out that he actually did have it. And so I think that, our families have been through a lot of trauma, even before this crisis happened. And so trying to figure out, what is the best way to proceed, trying to have family members tell them, you need to go get tested, you need to go to the hospital. It takes a lot. It takes a lot because, again, of all the barriers and everything that you're thinking about, while trying to make this decision. Well, do I have the money to go into a hospital or emergency care? It's something that, as you mentioned, the CARES Act is supposed to pay for treatment of COVID-19, but we don't know if undocumented individuals can get treatment. I know Luvia has been trying to get, an answer for this. We still haven't found anything that's, confirmed that they're able to get, assistance in the treatment for COVID-19. But we also heard that if there's other, issues that are plagued because of this virus, it may not be covered. And so, it's just a lot that our community members are going through. And, having the virus, it just means more medical expenses for them that they can't afford at the moment.
Sure, and I can share in the conversations we've been having, at least within the Democratic caucus in the House, providing care. If someone does get sick, making sure that they can have the care and that they're going to be covered. As you touched on, takes the pressure. There's a peace of mind that comes with it. The alternative approach that's been offered is, well, we'll just pay the hospitals for treating people who don't have insurance. But that doesn't mean that the people who don't have insurance know that they're going to be covered. It creates more uncertainty. So what we're trying to do is make sure that people understand we achieved it with no matter where you are, where you come from, you can be tested. We need to make sure if you get sick with COVID, you can be cared for without that uncertainty, and that's what we're trying to do. It's unfortunately not in CARES. It's included in the bill that passed the House Friday, but that's now being negotiated with the Senate. So we need to fight and work on that. And Luvia, you may have some experience with that as well. But I want to go to Angie next, because Angie, clinics like Rosalind Franklin, in the best of times, are working to get out into the communities, let people know here we are, here's the services we provide. In a crisis like this, that information is even more important. So if you could expand a little bit on what Rosalind Franklin is doing to get that message out and what we can do to help you get that message out.
Sure. So we, on our end, have reached out through email, text messages, and phone messages through our electronic medical system to all of our patients, notifying them of our services, of our COVID testing drive-through, hours of operations. We've actually set certain days of the week for example, Tuesdays and Thursdays, sick patients, Mondays, wellness visits, to make sure that we keep our patients, our staff, and our providers safe. We don't want to mix the sick ones and the babies that still need their vaccines. So we're really trying to communicate the best that we can. And I know there was a posting a couple weeks ago in the local newspaper about our testing drive-through. We received a lot of calls, our website, and through Michael Smith, who is the director of the community health engagement, the mobile community care coach, reaching out to our existing relations with Mano, Safe Place, Lake County Health Department. So we're doing everything that we can to reach as many people as we can. And our next step and our next goal is actually to mobilize in the care coach. As I mentioned earlier, we have the capacity, we have a lab, actually the RFU immunology lab runs our test. Testing turnaround time currently is at 24 hours to 48. so they have the capacity to run a couple hundred tests a day. We just need, now that you touched on the bill passing that everyone can get tested for free, that's good information that I can bring to the table. And now, I mean, how much more? We're just really trying to get out there to bring the service to them so they don't have to worry about coming to us when they don't have the means.
Great, thank you. And thank you and thank you to Rosalind Franklin for doing that. Luvia, I want to go back to you. You mentioned, we brought up earlier the concerns about being labeled a public charge as a cause for fear, and fear just in general about either being tested, receiving a positive test, so being infected or being sick and needing care, affecting immigration status, affecting other things. Can you touch on that? Again, I don't want anyone ever to be concerned about getting healthcare that they need, getting well. That's what we want for everybody. But I know it's a fear. We've heard it a lot, and if you could touch on that, I'd be grateful.
Sure. If I may, Congressman, I just wanted to reference something in regards to the hospital bills. Even though we still do not have assurance from the governor's office that treatment for COVID is free, I do want to tell people that even putting that aside, there is state law that says any non-for-profit hospital needs to provide financial assistance to anyone that lives in Illinois, is uninsured, and is low income. At the end, I am going to provide a hotline, which is ICER's hotline, in case there are any issues and people are being denied or not being offered that, which would be illegal. And we're happy to we're happy to involve the Attorney General's office. So just to mention that. In regards to public charge, I think at this point, many people know that the new public charge rule did go into effect back on February 24th of this year, despite some lawsuits, even though we still have a few pending. So hopefully there'll be some changes. But the public charge rule, again, when it comes to COVID testing, nobody should be afraid. But the main reason, just to highlight a little bit, the reason why people are afraid, despite a lot of outreach that everyone has been doing from community organizations to us as ICER, is that over 70% of undocumented individuals in Illinois live in mixed status families. So even if we tell individuals that it's not going to affect them, just the day-to-day lives, they're just afraid of something changing in the future. In case somebody does not know what public charge is, I always say, think of it as a test. It's mainly affects two groups of individuals: those that are seeking a visa, trying to enter the US, or those that are trying to adjust their status or change their status from one visa to another and they're in the US, or for example, if you're trying to go from a visa or undocumented and then trying to apply for a green card. Those individuals, through their immigration interview, will be asked a series of questions based on their skills, education level, income, and many other factors. Depending what they are, there's a long list of negative factors. And again, depending on the situation, skills, etc., if the immigration official thinks that this person in the future, anytime in the future, meaning even 10 years from now, the person may seek assistance from the government, then they could be considered a public charge.
Okay, great. Thank you for sharing that. And let me open this to the whole panel. And I've heard from a number of people who are going to work, their companies considered a essential employer or whatever. They're showing up at work every day. People feeling that they're not getting the necessary protective equipment to be safe while they're working. What are you all hearing in that context? And Angie, are you hearing anything specific to people you're talking with?
Yes, specifically to the workers, the grocery workers, having to use the same gloves for how many hours on shift, having to use the same mask for, reusing the mask. I know in our facility, luckily right now we're okay. It is hard to get PPE even for our healthcare workers. And you see that a lot in hospitals. But right now, we are a facility, we're okay with that. But yeah, we see it in the factories. You know, they tell them to wear a bandana, they tell them to wear a cloth instead of the facility providing the employers the PPE.
Mm-hmm. Dulce, you're hearing similar stories?
Yeah, and I think I've been voicing this since the beginning of the meeting, that the place of employment is one of the main reasons why our community members and Latino community are becoming infected and bringing that home. Again, not being able to get access to personal protective equipment, the employers not being proactive in not only protecting the employees, but also in regards to keeping their facilities sanitized, clean, and also sharing of information, right? As I mentioned earlier, we heard stories of community members that they knew a coworker stopped going to work because they tested positive for COVID-19, but they didn't hear a peep from their employer. And so I think that we need to do better in regards to making employers accountable, because again, if they're trying to keep their their line going, they have to be cognizant that if we don't practice social distancing, if you're not providing the necessary protective equipment, then of course people are going to get infected. I think it shouldn't be left up to the community members to figure out a way how to protect themselves, because again, they're already going through a difficult enough crisis that, for some of them, even having just a job, they look at it as, well, at least I have a job. If they can't provide me with this, well, at least I have a job. The other issue is, with this temporary employment agencies also sending workers and also not providing the equipment themselves, or if any worker voices any type of concern, then they get laid off. And there's 10 people lined up to get that job. And so that makes things a lot more difficult. I think, again, that we as organizations, as community leaders, we have to do better in being better advocates for our community members. At least right now, that's where, at least in Mano a Mano, we're seeing where the virus is, just taking a hold of, the employees and then bringing them home, but also in working with, the Lake County Health Department, they did see that there was a big disparity when they come up with these statistics. And so they did convene a working group. We actually met this morning. It's the Latino Community Partnership Group. And so we are meeting to find out solutions or ways to be sure that our community, is protected, but also to stop the spread of the virus, and what can we do in order to achieve that. So we are working with the community health, the Lake County Health Department, with other organizations, other Latino community members here in Lake County. But again, we do hope and we do count on your support, Congressman, to make these employer boards responsible for what they're doing. Not only are the taxpayers left, to foot the bills of, the medical treatment, the testing, but also they have to do something on their part, on their end, to be responsible and making sure that they're protecting their employees, especially those that are in vulnerable communities.
Right. No, 100%. And in the bill that passed last week, there's a reinforcement of that. OSHA, the Occupational Safety and Health Administration, has to be involved in giving guidance to the employers of how to keep their employees safe. But at the same time, we have to hold those employers accountable for following the guidelines, and when they don't, to be punished. At the end of the day, this is about keeping our neighbors, keeping our friends healthy and safe. And there are essential industries that we're going to have to keep open. We shouldn't be asking anyone to put their lives on the line unnecessarily, giving them the PPE, making sure they have the supplies, making sure that the government provides that guidance. and that the companies follow that guidance has to be a part of any solution that we do. Luvia, I want to come to you on this as well. Anything you're hearing, anything we should know about with respect to what employees are saying with specifically PPE?
Yes, I mean, we've been hearing similar concerns that both Angie and Dulce mentioned. I think many individuals, they're trying their best, whether it be by buying their own gloves or making their own masks, etc. But the reality is that many facilities are not providing PPE for different reasons. I think sometimes on the one hand, there is limited number available, but two, I think it also, to be very honest, direct, I think in a lot of occasions, sometimes they just don't always care or don't always prioritize our community despite all the work that they do. So I know that some of our member organizations are working on this and are advocating not only for the workers' rights, whether it be if they do want to not go to work because somebody did get tested positive, but also it is one of our asks when it comes to ICER's legislative platform to make sure that the governor is providing that as much as he can, as well as holding employers accountable if they are expecting for them to go to work.
Great, thank you. And I want to take some questions. We've got, and I should have said this in the beginning, I've got questions on the Q&A panel, I've got questions on the chat, so I'm going to try to pick up a couple from each. But before we go to that, I just want to comment. We've had more than 80 people join this call today. So again, I want to thank our panelists for joining us, but all the people who did join. And you know, we're talking a little bit about multiple levels of government here as well. I want to emphasize the work happening there. The bills, the CARES Act, the HEROES Act is the federal level. Luvia, you talked about legislation at the state level and executive orders from the governor, and our county and our municipal governments are all, we have to work together, and we have to work all as a community to protect everyone in our community. So that's something I'm committed to. I'm going to take some questions here as I look through the list on the questions line. If you're well, one real quick one was, Angie, how can people contact with Rosalind Franklin? You can mention that and I'll pull the next one up.
Yeah, so you can give us a call. The number is 847-578-3239. That is our main line. And that is a line to the MA's nurses station. That's one way that you can do it. And that's actually the best way to do it.
Okay, and on a question, Manny Hernandez wrote, one of the barriers to access healthcare, a big part of the social determinants of health, is the trust or lack of trust and lack of providers to whom they can identify with, the cultural background. The view of volunteers wearing Army uniforms, police cars with flashing lights in the facility that's considered governmental and not a health institution at Waukegan's testing site is a big deterrent for a lot of our community members. Manny, I guess it wasn't a question, but I see some heads nodding. I don't know if anyone wants to touch on that one real briefly.
So to touch a little bit on that, yes, I've also had patients or members of the community talk about concerns about false negatives, not having a healthcare professional and having the tests be as self-administered. How accurate are they?
Got it. And you know, some of these questions have major corporations located in Lake County contributed necessary funds. I know a lot of the corporations are contributing funds, donations, also PPE to the hospitals, and so there is okay, and looking for a lot of comments. Thank you for the comments. Looking for questions. I apologize for this. So will we soon be able to get more gloves and masks for places like public libraries, maybe by early June, from Victor Dixon. Victor, a great question. I'll touch on this, and if anyone else has thoughts. We've seen shortages of supplies, really making it problematic throughout the first few months of the crisis. I was on a call today with FEMA for the Midwest region, and we talked about, I raised the question of how do we get more. The legislation that passed last week, the HEROES Act, A piece of it was legislation I had introduced. I've been pushing for of getting supply chain management, making sure we have that PPE as well as the medical devices, the ventilators, everything else where we need it. So it's the hospitals, it's the nursing homes, it's the grocery stores, it's everywhere. We really need the president using the legislation passed 50 years ago, or 70 years ago, I guess, the Defense Production Act, working with our companies to get that supply available, and then working with the states and the Federal Emergency Management Administration to ensure that we can have necessary what we need at hospitals and healthcare centers like nursing homes and clinics like Rosalind Franklin, moving it to the essential industries, and eventually as we start to open up libraries and hopefully schools, that it's there as well. So this is something that we need to be putting pressure on government at all levels possible. This is from Carolina Wentz. Is there assurance that employees can't lose their jobs if they exercise the right to stop going to work when they know firsthand a coworker has tested positive? But I'll expand it. What have you told people, and then I'll touch on it to close. What have you told people who say, I'm afraid to go to work? I just am worried about getting sick. I've got health conditions, or someone in my family has underlying health conditions. I just can't take any risk in bringing this virus into my home or infecting my family. Have people been asking you those questions, Luvia?
We have gotten some of those questions because we're not a direct service organization, and we don't see patients like Angie and Dulce to a lesser extent. For our undocumented community, the answer unfortunately is a little difficult because on the one hand, individuals do have the right to not go to work, but when it comes to unemployment insurance, they're not able to claim it. Other individuals would be able to claim unemployment insurance if they choose not to go to work because of their safety or because they need to take care of a loved one that was tested positive.
Dulce, how about people coming to Mano a Mano? What are you hearing, and what have you been telling them?
Yeah, well, same as Luvia stated, unfortunately, they don't have something to fall back on. And so they are afraid to go to work. They are afraid of, bringing this virus into their homes. But unfortunately, and even if they have a loved one that has tested positive, they don't have the luxury to, unfortunately, not go to work, right? Because they're not eligible for unemployment benefits. The other thing too is that unfortunately with these employers that have over 500 employees, then we know that some of the policies that were passed through Congress, whereas if you tested positive, you would get I believe it was 80 hours paid leave. Unfortunately, they don't qualify, and so that's not something that they can offer to the employees or something the employees can take advantage of. And again, not having any personal time off or any personal benefits, vacation time, sick time, they don't have that luxury. And again, most of these employees are contracted by temporary agencies, employment agencies, and so they're not eligible for any benefits because they're not permanent employees of the company. So again, it's putting themselves at risk. But some of them, they have been vocal. They have called us. They said, I don't feel safe here at work. What can I do? Who can I contact? But they want to remain anonymous. The other issue that, one of the things that not only the Lake County Health Department, but also us, is that individuals that do test positive and they say, I work at a factory, most often than not, they're not going to disclose the name of their employer for fear of retaliation, for fear that the employer is going to find out and they're going to get terminated, or for fear that the factory is going to be closed down or shut down by either the health department or the state, and they have family members and friends that work there. So it's a fear factor overall, unfortunately. And again, it's because of, not being able to access, the benefits that the majority of us are able to access that, puts these families in very difficult situations, and they have to make very difficult decisions.
Got it. Well, thank you. And I do believe to that point, and then I'll get to my last question for all of you, is if someone does have a concern about employer, there's a number for the Lake County Health Department, at least in Lake County, to reach out to. I'm sure the same is in Cook County. But my last question for everyone, and Luvia, I'll start with you because I saw you put it up on the message board for everybody. Where can people go for help as we wrap up? What should we make sure everyone knows about as far as if I have a concern, if I have a need, who can I call?
Sure. So yes, just how you mentioned, Congressman, I did put in the chat box 2 different phone numbers. So locally, Mano does assist anyone that needs assistance with public benefits. If somebody is on here that does not live in the area, we do have a statewide program that could assist anyone to apply for Health and Human Services programs. That's through the Immigrant Family Resource Program. And that phone number is 855-437-7669. If you have issues when it comes to health access, or as I mentioned before, hospital bills, etc., which should not be the case, we also do have a hotline that you could access for a couple of different services, from detention to immigration matters, but also around healthcare. That hotline is 855-435-7693. I also put that in the chat box. And lastly, for those that care about at the local level, or I should say at the state level, we do have a town hall this Thursday, which is May 21st at 4 p.m. Through ICER's Facebook Live. It will be public, and we are going to be taking advantage that this week the governor and the legislators are in session. So we do want to make sure that our priorities are being heard and the immigrant community is being heard.
Great, thank you. Dulce, how about for Mano? Who can people contact?
I will put our phone number on the chat box, but again, one of the things that we're focusing on right now is the TANDA, this emergency community fund for undocumented individuals and families. We're providing, basic necessities, again, groceries, prescription medication, any personal toiletries, so on and so forth, diapers, formula for babies. Unfortunately, some of the organizations here in Lake County are not able to provide this type of assistance because you have to have, you have to meet their eligibility requirements. And so that's what we're doing right now. Also, a great source I would recommend is the 211 phone number, where we have all the resources in Lake County available, and they do speak Spanish. So for those that need, for example, rental assistance, I know that ACES in Waukegan is helping with rental assistance. And so, for Mano, we continue providing the same services that we did in the past, whether it's legal immigration, whether it's our online classes, adult education for GED, ESL, our citizenship classes, also our Successful Children's Program is continuing to provide our kindergarten readiness online. But again, most importantly, Mano is a welcoming center designated by the state of Illinois. And so our purpose is to, help individuals access public benefits, access healthcare, and whatever we can do. If we don't provide that assistance, we're more than happy to assist our community members in finding someone that will.
Great, thank you. And Angie, how about from Rosalind Franklin?
I actually posted our main line as well as my direct number for those organizations that have more questions on the testing and to be informed, and we can keep communication on how we're going to be able to bring these testing to our community. So the our main line here is 847-473-4357. It's also on the chat. And like I said, my direct extension, my direct contact is also, I also posted. So if you guys have any further questions, you can always contact me personally.
Great, and thank you. And for my office, with any questions, the number is 847-383-4870, or our website, schneider.house.gov, Schneider, my last name, .house.gov, and please reach out to us. Before I say thank you, I have to do one last plug, and looking at the names that are on the list, this is probably the last group I need to, because you're already there. but I do it every time. We've got to make sure we fill out the census. Please, I saw for many of the names, many of you on this call are folks who have a good reach to others. Make sure we let everyone know. Anything I can do to help you get that message out. Like I said, I know I'm preaching to the choir here, but I'm going to preach anyway. Let's get the message out. Let's make sure everybody gets counted. You know, it only takes a few minutes. So let me thank Dulce, Luvia, Angie. Thank you guys so much. This was wonderful. Everyone who was on this call, thank you. I say this every time. We thank all the heroes who are staying home and being safe, but the heroes who are working every day, in particular in the context of our conversation, allowing those staying home to be safe. The healthcare workers, whether it's Rosalind, Franklin, or in our hospitals and our clinics, the people who are stocking our grocery shelves, people driving products across the country, making sure that our streets are clean, our streets are safe. I mean, you just run down the list. So many people are working so hard and literally putting their lives on the line for us. We owe them a great debt of gratitude that we've only begun starting to discuss in conversations like this, how we start to pay that debt. We have a long way to go. Our goal is to make sure everyone has to be safe. Everyone has to have the security they deserve, the healthcare that is a right. That's what we're working on. So to the panelists, again, thank you. This was wonderful. We will continue this conversation. We will get through this. I have no doubt we will get through this. I am confident we will get through this, but we have to do it together, and we have to do that so everyone comes through it together. So I look forward to working together with you in the weeks and months ahead. So thanks, everyone. We will talk to you soon. Stay safe, stay well, stay healthy. Bye-bye.
Thank you.